Hi, I'm Carrie Elizabeth Lynn. I'm a licensed professional counselor and I also have bipolar disorder myself. Today I'll be explaining the symptoms of a hypomanic episode. You'll find that hypomania is very similar to mania. The main difference between a hypomanic and a manic episode is simply how severe it is. Hypo means under or below, so hypomania refers to symptoms that are below mania in terms of severity. So, a diagnosis of a hypomanic episode requires several things. First, there has to be a distinct period of abnormally and persistently elevated, expansive, or irritable mood and increased activity or energy. These changes in behavior have to be present most of the day, nearly every day, and they have to last at least 4 consecutive days. That's in contrast to a manic episode, in which they have to last a week. Second, a certain kind and number of symptoms need to be present during that period to a significant degree and representing a noticeable change from usual behavior. These are the same symptoms found in manic episodes. So, as with a manic episode, there have to be at least 3 of the following symptoms. Or, if the mood is only irritable, not elevated or expansive, there have to be at least 4 of these. Number 1, inflated self-esteem or grandiosity. 2, a decreased need for sleep. 3, being more talkative than usual or experiencing a pressure to keep talking. 4, flight of ideas, which is where your thoughts rapidly shift from topic to topic, or a subjective experience that your thoughts are racing. Number 5, distractibility. Number 6, an increase in goal-directed activity, for example, at work, at school, in your social life, or sexually, or psychomotor agitation, which is where you're extremely restless, so you make unintentional movements like pacing or wringing your hands. And finally, number 7, excessive involvement in activities that have a high potential for painful consequences. For example, going on buying sprees, getting involved in risky sexual situations, or making foolish business decisions. Third, the episode has to represent a clear change in functioning that is not characteristic of your usual behavior. Fourth, the episode cannot be severe enough to cause impairment in life functioning or require hospitalization, and it cannot include symptoms of psychosis. And finally, the episode cannot be due to the effects of a substance. So, those are the symptoms required for a diagnosis of a hypomanic episode. Again, the main difference between a hypomanic and manic episode is severity. While a manic episode, by definition, causes a marked impairment in life functioning, requires hospitalization, or involves psychosis, or in some cases, all 3 of these, a hypomanic episode does not. However, in bipolar 1 disorder, hypomanic symptoms can potentially get worse and end up turning into mania. I'll be describing the different types of bipolar disorder in future videos in this series called Speaking of Symptoms. Thanks for watching, and here's to good mental health.